MRIs, I want to talk a little bit about diagnosis and imaging and things like that. MRI for sacroiliac joints is central to diagnosis, but access and interpretation vary widely. What are the most common MRI pitfalls, in your opinion, that lead to both maybe overcalling and undercalling of the condition?
Right. So, you don't necessarily need the MRI to classify. You could even find, changes on an X-ray and that might suffice. And that's in the classification criteria. But MRI is pretty helpful. It's very good. As you mentioned or alluded to, it could be also too good. So some of the pitfalls, typically, rarely you can actually have early axial spondyloarthropathy and not have MRI changes. That's not very common, but it can occur. But as you alluded to before, it's very common to have overcalling of axial spondyloarthritis. So sometimes, we're looking for, arthritis of the sacroiliac joint. That again is a joint where the spine joins the pelvis in the back. We're looking for erosions. We're looking for bone marrow edema or swelling, inflammation in that area. When an MRI picks up these findings, right, it's just saying, hey, there's edema, or hey, there's swelling, hey, there's inflammation. It cannot tell you what that is from, right? So, active runners, athletes might have some edema or some swelling in the sacroiliac joints. Particularly after pregnancy, you can notice some changes also in the sacroiliac joints. Sometimes just having, getting older, you can notice changes in the sacroiliac joints. So the whole diagnosis is sort of put together by the history, what the patient tells me, what I find on examination. Those are signs, blood work, and then, taking the MRI into conjunction with everything. And that's how we would arrive at the diagnosis without putting too much weight on solely the MRI.
How do you see the role of HLA-B27, CRP, ESR, and other biomarkers today? And are there any emerging biomarkers you are particularly watching in spondyloarthritis?
Right.
Is
So
that
currently, we do know that there's a strong association between HLA-B27 and which is a gene, and your risk of developing spondyloarthritis. But I would also say that this can also be ethnic specific. So Latin Americans or persons who are of African ancestry may not necessarily be HLA-B27 positive, but they can also have axial spondyloarthritis. So there are other genes we think that are at play with this. Um, the erythrocyte sedimentation rate and the C-reactive protein are inflammatory markers, which let us know whether there's active inflammation going on. Your ESR and your CRP can be high for multiple different reasons outside of inflammatory arthritis. And then secondly, up to 40% of patients will not have an elevated CRP or ESR. So another reason why we have to kind of just put everything together. Um, Unfortunately, we don't really have many biomarkers, but probably more recently, antibodies to CD75, has been thought to be an emerging biomarker just to determine, someone's risk of developing ankylosing or axial spondyloarthritis.